Now, as you can imagine, when we do someone's explant surgery, we're dredging up all the reasons that led them to get that done. And all the, if there's unresolved situations or trauma or abuse or whatever, you bring up all that, and then you get a lot of really strong reactions.
Hello, and welcome to the Energy Flow podcast. I'm Kelly Kennedy, and I am here to discuss all things energy, fascia, lymphatics, oxygen, and water. Over my 26 years of being on this journey and 19 years in clinical practice, dealing with chronically ill, chronically pained, to the optimizing of health and to everything in between, we have learned throughout these years how to efficiently and effectively teach people how the body works, get them engaged in that system, help them understand how the universe works and how those two connect. And that's what this Energy Flow podcast is about. Whether you are new to us or you've been a longtime listener of over 4 years now, we are so happy and honored to share our heart's honest truth about what we know, what has worked for us, what's worked in the clinical practice, and what might be the key to your next step in your journey. Thank you for joining us, and thank you for sharing this with all that it will resonate with. We look forward to each and every moment of our genuine connection. Thank you for listening. So for those of you who don't know, Dr. Robert Whitfield is a board-certified plastic surgeon, and he focuses primarily with breast implant illness. And I don't know much about your curriculum vitae other than I've watched you on other podcasts. I've been in rooms with this person. And there's a lot of people that I'm sure try to get his time and everything else. And he's one of the most giving people, honestly, I have met in a very long time, who truly pours your heart into people just from a marketing perspective and like business perspective, let alone I can imagine if my health was in your hands and I was one of your patients that had to come to you and have surgery. But you are a surgeon. And if you want to speak to your CV, I would love it if you don't mind, because I didn't, I'm a fireside chat lady.
Yes, for your audience. So my background is rooted in oncologic surgery. So I trained in a traditional surgery training program. I spent 6 years learning how to take care of patients from a general surgery perspective. And then I was very interested in reconstructive surgery. So in our country, as in many countries around the world, that kind of limits what you then do, because cancers that require reconstruction may vary. The most common cancer we encounter, unfortunately, is breast cancer. So my sister was a breast cancer survivor. She recently passed away in 2024. And breast cancer, because of its prevalence, has led to more and more reconstructive surgery for that. So that ended up being a large part of what I did, in addition to head and neck cancer and sarcoma reconstruction. So for, the first 19 years of my career, primarily, that's what I did. I also did implant-based reconstruction from time to time, but that was not my focus. My focus was microsurgery and performing microsurgical reconstruction using what was called the DIEP free flap. And that was something that used the abdominal tissue that would be discarded in a tummy tuck and was allowed to be revascularized, much like we do a transplant of a kidney or a liver. We hook the artery and vein, if you will, back up, and in the kidney, the ureter. So in this situation, we take the tummy tissue, leave it attached to the blood vessels, and then anastomose or connect those blood vessels to the blood vessel underneath the sternum, the internal mammary artery and vein. And that's how we get that to revascularize and be the breast reconstruction.
That's like a fat transfer.
So that performed the bulk of the reconstruction. And then, because I did that predominantly, we would do fat transfers over that reconstruction, and that would provide the finishing, if you will, of that, because many times mastectomies leave a obviously asymmetric three-dimensional defect. And then when we use the tummy tissue, you can't make it a perfect breast shape. So then we would go back and add fat to that result. That's why I got so much experience doing fat transfers, because we would do 100 to 200 of those a year over the course of the 19 years I was doing those surgeries. And, all things being equal, I got very adept at microsurgery, very adept at fat transfers, very adept at taking care of breast implant problems because of the breast reconstructions done in the United States. The predominant form of reconstruction is implant based, and people will ask, like, why? Well, our country is enormous. I'm in Texas, and you can fit Spain inside of Texas for everybody listening. Once you leave our larger geographic cities in the United States, you're in communities that are, um, they're going to be limited in terms of resources and access to equipment, to skilled nursing, to surgeons with my training. And that's going to limit your options. It shouldn't, but that's just what's going to happen because people don't want to leave their communities. That's where their families and friends and support systems are, and we understand that. But I will and still take care of people from all over Texas, the United States, and Europe and Asia. So that just led itself to a broader experience. So if I were speaking to you or another client about the options of reconstruction, there wasn't something that I really couldn't do or couldn't offer because of my experience over time.
That skill set is due to experience, right? I think is another thing you're lending to is in the smaller communities, you just don't have the experience because you don't have the numbers. It is a little bit of a numbers game that increases your skill set, and that can't be understated, I would say. And
Right.
so sometimes you have to travel to get to somebody that does things like this more often, but it is a very unique lens that you have. And for me, as a lymph therapist, as a lymph queen in the fascia and lymph world, I know there's reasons for women to get breast implants that are beyond just beauty, right? Like they have to do it because they've had cancer and there's a lot of self-esteem issues with it. And so it's not a black or white issue for me. Nothing in life is.
Right.
And I would love your take because I think for so much of my audience, they tend to think I feel very black and white about things. Oh, you should get all your amalgams out. Yes, I do feel like that's true, but at the right time. Do you have all your cavitations done? No, not necessarily. Do you have to get your breast implants out? I'm not a big believer that you have to every time. What is your take on that?
Yeah, and I'll just go back for a moment. So I was the first person to do a lymphaticovenous anastomosis in Austin in 2013. So we were doing lymphatic surgery to help decompress arms, in particular after mastectomy, of course, that had developed lymphedema. And so we're uniquely aware of and want to help promote and support the lymphatic drainage of all the patients. Obviously, in our place, we take great care in supporting that. And as it relates to, does someone need to have an explant in every situation? And the short answer is, the way I look at it from a genetic standpoint, you're going to have people who detox really well. And those people probably will never get to my doorstep or not get to a inflammation standpoint where they need that help. But as you know, as well as I do, many people don't detox well. And so if we just look at a common gene polymorphism, MTHFR, a lot of people have heard of that. It's got a very quaint name on the internet. We won't repeat, but just in general, that affects a large number of our clients. It'll vary in different reports, but we'll just say roughly like 36% can be affected. That's a high number of patients. And if you use that's one hit, it probably doesn't take many more of those hits, whether it's genetic or an environmental exposure, a problem with our diets or our sleep patterns or something that will make it so that it's very difficult for us then to detoxify and feel well, each and every, it's like a rinse and repeat every day. Just like promoting great lymphatic drainage, you have lymphatic drainage for your brain that happens at night. But if you don't get to or have enough sleep cycles or depth or quality, that doesn't happen. So you wake up with brain fog. I constantly have patients with one side or another with delayed lymphatic drainage after surgery. And you can speak to that, but we use Flowpresso to help. The most efficient filtration system in the world is the body. So we're trying to just help it, move its fluids around more efficiently. So I I feel like I can help more patients by number one, providing our programming and what we've learned about and basically reverse engineer what I do after surgery. And so if you just take everything I do for patients pre-op and post-op and give it to the patient who has implants, who doesn't know whether or not they have this problem.
Yeah.
And if they do have this problem, they certainly don't want to come see Rob in Austin to figure out what to do about the problem because nobody really wants surgery for this problem. They had surgery, and if you ask most of them, it was one of the worst surgeries they ever had, almost uniformly when they talk about it. And there's a number of reasons why that's a problem. But you know, the most important things is certainly helping someone's immunity, proper lymphatic drainage, proper diet, proper rest, proper hydration. Those things all cumulatively add up to make a big impact.
Well, in my world, we say never does one thing cause one thing, right? And what you're saying is essentially lifestyle. If you're not doing anything to clean it up, eventually you're going to have a drainage issue and a detox issue because we live in a very toxic soup. And if they apply what you teach in your programs before, like as soon as they get the breast implants, and they can keep everything else clean up so that they can enhance their ability to handle the implants. Is that what I'm hearing? Just for clarity?
I think, you make the appropriate observation. The world is not getting any easier to live in. And so the things that we understand that we can, control, if you will, to the best of your ability, like the air you breathe, the fluid you drink, what you drink it out of, the food you eat, the quality of the food you eat. And then really, I think the most important thing that's really underrated in all of this is sleep. If I get a poor night's sleep, I'm not going to perform, adequately. And universally, every patient comes in and says in the morning, when I see them, they're like, "Hey, did you get a good night's sleep?" And, that's a great question. And I'm pretty rigorous about my sleep habit. Like I get up at 4:30 on the days I operate. So I go to bed at like 8:30, no later than 9 o'clock the night before. So that I get enough rest and get enough sleep cycles and depth of sleep and quality of sleep so that I am able to help take care of all those patients the next day.
Well, being a surgeon is like an athlete, and we appreciate you who are under your knife, and all the women and men that are under your knife, that you do get proper sleep and you're on the top of your game, because I couldn't agree more. And I really know that that's one of the benefits of Flowpresso that I know very well with Desiree, that when she created it, when we started doing heart rate variabilities on it, and we saw the shifts in the parasympathetic nervous system, the lymphatics was almost the secondary, and the ability to shift it into the deep state of relaxation, so the body's in that deep state of rest, was really the benefit. And the lymph was like secondary at some level, because that deep rest is so key for healing. So, and we can transform. We're pleomorphic, as you said. By the way, I love that you use that word. Love you even more now. So not every woman has to have them out. At some point you may need to. Now, I have one question about fascia. What I've seen in pictures, and I want you to speak about mold too, because you mentioned something at the retreat that I kind of was like, "Whoa, really? Could we talk about that?" And you know what it was, I think. But the fascia, what I've seen in pictures and what I know to be true, the body has a foreign material in it. It's going to wall it off. It's going to try to block it off, and it's going to create like a shell with a fascia, and then that creates lack of drainage, right? Because that's going to block down some of the lymph. How, like, how do we balance that with? But it really helps the person feel good about themselves and overcome whatever disease they were dealing with, or they needed it for some various reason. You know, there are breast implants that are put in because it's elective and some that aren't. Either way, it ends up there's implants in there and we've got to deal with it. So there's this fascia piece that I'm really like, ugh, is that really restricting flow? And does the body ever see it as part of it?
Well, I'll answer it in that. So I had a dual appointment at the university I worked at, and it was in plastic surgery and orthopedics. So I helped a lot of uh, orthopedic patients with cancer or reconstructive needs from trauma, infection, tumors, and they may have a hip or knee replacement. They may have treatment because of a sarcoma. And when you have these large prosthetics in place, obviously your body naturally responds with this is foreign, and it creates basically a scar tissue around it. And that's the tissue that's around the implant. Doesn't matter if it's a hip, knee, breast, cardiac, neurologic. The body responds and creates scar tissue around it for the most part. And that woven network of collagen, we'll say, is not impervious. So there can be communication between the tissue and that device. So we recently published a paper where 29% of the explanted specimens had a bacterial contaminant. Bacterial, not fungal. So fungus, in my experience, is less than 5 out of 1,000. So it's not something that's plays a role. So once again, all things being equal, the bad actor here is Cutibacterium acnes and Staph epidermidis. Cutibacterium acnes is found in high concentrations on our chest, shoulders, neck, and facial skin. And Staph epidermidis is one of our common bacteria that is colonizing our skin all over our body. Those two bacteria readily produce biofilm, and when the bacteria aggregate together and form a community and produce this, biofilm, if you will, makes it harder for your body to get that eradicated. Just naturally circulating, we have natural killer cells that protect us against cancer. We have all of our, army of immunity, if you will, that's constantly surveilling our body. But when we have a foreign body in it, like an implant, it can't resolve that. And when they act together and form this kind of biofilm that makes it harder to eradicate, then you can have these signals that potentiate immune system activation, lead to fatigue and pain and all sorts of other chronic inflammatory symptoms. So as it relates to scar tissue, when we're trying to help each patient, because about a third of them will have a bacterial contaminant, and very rarely there's a breast implant associated anaplastic large cell lymphoma for these implants that are textured. There's also now a breast implant associated squamous cell carcinoma. So there's all these different things that are coming up, and rather than be concerned with those on the back end, our guidance has been removal of the scar tissue, obviously in a safe and appropriate way, and then, let the patient heal, let their lymphatic drainage, recover. And we do see a lot of people have congestion in the lymphatics. I just saw a patient before I came to do the show that had just one side that was a little bit slower. And she sets, she told me, she's like, I've always had trouble on this side. I'm like, yeah, I mean, our bodies are not symmetrical at all. And from a lymphatic standpoint, they're certainly not symmetrical. So it really bothers patients when they have one side doing something either if your perception is slower or faster than the other, because they don't understand the lack of symmetry, but that's just nature, basically.
Yeah. Well, scar tissue, it's funny you bring that up because I teach a lot about scars and getting rid of the cathexis that's in scar tissue, being a lot of the sympathetic nervous system fibers and the traumas. So it leads me to two things. One is that with scar tissue, when you say you're removing the scar tissue, so when you go in, you're saying you explant somebody, you're removing all the scar tissue, removing all that fascia adhesion, and you're letting it. If you were to do a transfer, a fat transfer, you would do it like after they healed, kind of like a cavitation in a tooth experience.
So there's two ways to do it. Um, the way I think about it is if you want to give people an option for a fat transfer, you can do it at the same time, or you can do it delayed. And there are arguments and pros and cons to each. The argument to do it at the same time is to give the patient some volume restoration at the same time. So you're not completely taking all the volume away, and you're trying to add some back. And this is, akin to what we were doing in cancer reconstruction, and then to a larger degree, down the road, you would then continue to augment and refine the result. In a explant patient, because of the nature of it being a cosmetic procedure, typically not a cancer reconstruction now, you're trying to, if you can at one time, remove all of this material, reshape the breast, add volume back. So there's a lot more variables you're trying to control for. And many providers just opt to not do fat transfer at the same time. And maybe just from my past experiences, I didn't feel like that was um, a completely non-negotiable. So I have become more selective about it in terms of providing, you know, more information regarding like how do we detox through genetics and looking at we mentioned MDHFR, but there's a whole host of things we look at. And then adding for context their gut health and their your toxic burden triggers in their diet. And for a moment on toxic burden, like a really underappreciated problem is mold toxicity. I am like almost taken aback by how many, times I see mycotoxins at extremely high levels. And it's pretty striking how difficult this group has detoxing that. And their level of exposure seems it's disproportionately high.
But you're saying that the mold isn't coming from the breast implants because that's more bacterial. But in general, the women that have the implants that seem to have BII are having some kind of mold exposure that's really hard for on your mycotoxin test, and you're seeing high, right?
Right. So
So,
people ask me all the time, is it mold coming from the implants? I'm like, no, I
right,
did that study
I want
and
that to be
proved
clear.
that is not where it comes from. So this is like our bathroom, our shower, our fruit, our vegetables, our grains, or our coffee has mold. Wine has ochratoxin. And so
Butter, all the nuts, blah blah blah. Yeah,
aflatoxin from nuts and things like that. So people will probably get tired of hearing me say this, but like I see it. So, I can't like not talk about it. It would make no sense. And then there'll be some people like, is that a conventional test? Well, I'll tell you, I had a gentleman who I know uh, say, "Hey, can I show you this blood test?" And I'm like, "Yeah, sure." Because everybody's got something on their phone they want to show me, right? Some kind of test. And so I look at it, and he's got like really disproportionately high amounts of mycotoxin in his bloodstream. And now, for everybody listening, now it's one thing to be detoxing that and excreting it through your kidneys. It's entirely different to have it show up in high amounts in your blood.
yeah. That means your body's not filtering it. and it's seeped in the spaces between the cells and the lymph, and then it's dumping into the cells and junking them up, and then they can't dump their shit out, and it's a bad hoarding situation.
So in that instance, that person could definitely have an implant that got a mycotoxin on it. But I was looking at that going, hey, this is not good at all. Like, when was this done? Like, these are bad, man. I don't want to ever see somebody's blood results have an elevated ochratoxin or aflatoxin. That means, to your point, you're becoming exposed in the bloodstream, and when you get things like that going on, I don't think people understand what's happening then. You know, that will overwhelm a system and make you ill and or lead to really severe health complications.
It creates a cascade because now your rain barrel's full. It's overflowing when it's in the blood system that deep. And now you've got cleanup on aisle 7 and 14 and 4 and 3 and 6 and all of the things. There's too many balls to juggle, and it's going to drop it. And that's when you're going to cross that biological division and get into cell de-differentiation and impregnation and all the cascading diseases. That sucks. Listeners and viewers of the Energy Flow podcast, I'm only interrupting to tell you about the membership program that we launched a few months ago, where you can access all things energy, fascia, lymph, oxygen, and water, brought to you by the True Wellness team, myself primarily, with a lot of videos and a lot of blogs and a lot of recipes and all the things to support you to apply the science of energy in your everyday life, and how to do it simply and organized in a platform and with community. Once a month, this community gets together in a Q&A where you get to ask me questions. We've had beautiful interactions and beautiful questions already in just a few months. Join us. Become a supportive member here on the podcast for just $7 a month. You can be a tier 1 part of our Energy Flow Forum, where you get to go a little deeper into these podcasts offered to you for free. Or for $23 a month, you can be part of all of the things that we just discussed. I look forward to seeing you on our membership platform and at our Q&A. For me, you are such a glorious human being, the work you do. And this might be a little out there, but I want to bring up something that's come up for me in the last few years. So scar tissue is something that scars will block the nervous system, right? And I agree with you. There's way too much MTHFR. Like we stopped blood testing people on that like 8-9 years ago, because I'm like, okay, it's 70 to 80% of the people we blood test have MTHFR. Got it, and Epstein-Barr virus and co-infection, same thing. So with that said, for me, in looking at the spiritual and emotional component, not just the physical component to life, what is the underlying cause from your perspective of why, okay, one, why do they get cancers? Because you worked in that in oncology, and emotionally, from an emotional perspective. And two, if they're getting breast implants from I need to make an imperfect body perfect, could you speak to that from a psychological? I mean, I know you're not a psychiatrist, but I also know you work in this world, and I know your heart from spending a few days with you. And I would love to get your take on
Yeah, I mean, from the psychologic standpoint, I've interviewed a lot of patients, obviously over the course of the last 9 years, and recently we've had patients come on the podcast and give their experiences, and it's a really broad range of reasons why people choose to undergo breast augmentation. Of course, the natural one would be they didn't develop, and they were always kind of feeling less feminine because of that. And that's a common one. But I had a patient tell me they wanted to get a breast augmentation because of Baywatch. And I was kind of taken back by that because I didn't really think about that. Um, One, because I never watched Baywatch, but two, because the influence, that television, our television, particularly in the United States, has on us here and all over the world, because this patient was European.
Mhm.
And
Wow.
that caught me off guard. And then another person said Barbie,
Ooh.
playing with Barbie. And I was like, okay, I get it. But once again, I was like, okay. And then there were obvious ones like peer group acceptance, like mom had it and other moms had it. So it was fine. Um, yeah, you know, there's a book written by Amanda Savage Brown that talks about the breasts, and she's had an explant and she's an authority, in the space, and gives you these kind of thoughts. You're socialized a certain way, and it creates the playbook in your head, and that's kind of how these things, were borne out on the shows that I've done, and yeah, I mean, now, as you can imagine, when we do someone's explant surgery, we're dredging up all the reasons that led them to get that done, and all the, if there's unresolved situations or trauma or abuse or whatever, you bring up all that, and then you get a lot of really strong reactions. And to your point, I'm not a therapist, don't claim to be one. So we encourage people to get that work done ahead of this, because this is not, uh, despite that, which you need to work on, which is always yourself, but
Right.
in addition to, um, yeah, that's that's a complicated one.
No, I know. I listen, and I'm gonna go to a whole nother level with the next one. So we're quantum beings having physical experience, right? We're divine beings having physical experience. We're more frequency of light and sound than we are physical, right? We have a magnetic field that's about 6 feet outside of our body that is all non-physical. Well, there's more non-physical part of us than physical. Can we alchemize our breasts just into like, plasmatic silicone that's like biocompatible?
Not that I'm aware of, but I mean, I'm hopeful that, yeah, I'm hopefully that from a mental situation, the younger um, women, as they come up. I have a 16-year-old, and I get, people try to pigeonhole me and ask me if I would let my daughter get breast implants.
Mm.
And so, for everybody listening, I'm a Leo. My daughter's a Leo, and you're not going to tell Leo what to do. It just doesn't work. And when you're younger, it's even worse. So I'm 55 now, and I'm a calmer Leo, but my daughter's not. And the more you push, the more they push back. And so, you know, you have to, meet people where they are, not try to invoke some specific belief system on them. So I can simply tell her, based on her genetics and ability to metabolize estrogen, kind of the world we live in, it would be harder for her to cope with a device. And that's part of making an informed decision, which is usually what my patients complain about not being part of when they had it done. I get if they had known XYZ, they would have never got that done. Well, typically these are being done in younger patients. And as a younger person, it's probably very, very hard to sit and read a consent form that's like 10 to 20 pages long and speaks in, legalese.
Yeah.
So the things you always have to remember when you get an implant is hip, knee, breast, dental. They all can get infected.
Yeah. You're
That's
cutting the body, which to your point earlier, like try not to cut into the body any more times. That's one of the reasons explant scares me, not scares me, but concerns me because you're cutting into the body. Sorry, didn't mean to interrupt, but yeah, it's
Well, right, right. Nobody, you know, it's it's a yeah. So 2.2 million implants get placed worldwide annually.
2.2 million implants of all kinds, not just breast implants, appliances,
Breast
breast implants only 2.2 million a year.
annually.
Holy crow, I had no idea it was that high.
Yeah, and those are low numbers. Just so you know, that's the lowest possible number I could give you because that's what's reported.
Right, right. Because in a lot of countries, there's shacks.
Well, the implant companies sell implants to non-plastic surgeons.
What?
Oh yeah,
Who?
you don't want to know.
Okay, I don't want to know.
The short answer is I've taken implants out from all over the world, placed by whoever, and this is not a problem that's ever going to go away. Doesn't matter if they're pulled from the market, it's not going to go away. The first implant was placed in 1962 in Houston. So we have all of those years. And for everybody listening, it does not matter if you have silicone filled or saline filled implants, the shells are all silicone elastomers. So
They all have silicone.
not protected one versus another. And until I always try to leave everybody with a anecdote. The last surgeon to win a Nobel Prize was Joseph Murray. He performed the first kidney transplant. He did it in a Siamese twin. So that Siamese twin kidney transplant demonstrated technically you could take a kidney from one and put it into another. So there's an artery, a vein, and a ureter, which is the tube from the kidney to the bladder. And so he technically started what would become transplantation by performing that. But the trick is he did it in a Siamese twin. So it's basically obviously an identical twin. So there's no immune response. There can't be because it's the same.
Right.
All right. So moving forward, we start transplantation. Transplantation is
That's isopathic. That's same treating same instead of homeopathic, like treating like. Oh my, that's so fascinating. I did not know that story.
yeah. So this starts transplantation, but University of Wisconsin-Madison created a solution, the UW solution, helped preserve organs. And then we had prednisone, and then there's cyclosporin. So these are the immunosuppressants that allowed us to perform organ transplantation. Fast forward now, it's not a big deal for us to perform an organ transplantation technically or get it to survive with compliance on medication. Now, with the advent of GLP-1 agonists, semaglutide, tirzepatide, so these peptides, these glucagon mimicking peptides, God, I can't talk today. So they are going to reduce, their diabetes medicines. So they're reduce blood sugar. And what will that do? So ultimately, you'll have less obese patients, less problems with diabetes, less problems with kidney failure from diabetes. So you're going to have a lot less dialysis, a lot less people getting transplantation. So for the first time ever, you're going to have something that really modulates behavior, that affects the immune response, that then you walk back all these things that we did over time to modulate the immune response. So for our patients who are responding, with this, we've tried to create a whole nother program for them to have autologous augmentation with their own fat, because it's, a more holistic way, if you want to think about it, to do
Same
uh,
treating same.
yeah, because if it's autologous, which means it's your own, not allogenic, which means same species. Autologous is your DNA, so it's not going to get rejected. Anything can obviously get infected, etc. But there's no need for an immune suppressant because it's your own.
Right. There's no
So,
foreign material in it that looks foreign to the body to create an immune stimulation.
right. And just like if someone were to get a peptide injection and they had redness at the site, it's not so much that it's it's more of a reaction to the synthetic because
Right.
it's not autologous. It's not your own. So I feel like as we, and I know I got a little off topic, but as we transition more and more into a time where people want to use their own versus implant something, because I have a lot of that, that's the ask now. Well, what can you do differently? Well, I just take all the, years of experience I had doing fat transfers for cancer patients, and we apply that to the cosmetic patients. And for those who can have it, that's a good alternative that helps both from a physical standpoint, a psychological standpoint, hopefully emotional standpoint to give them the results that they're looking for without the, quote unquote downside of a device.
And I would also say the informed consent piece you brought up is huge as well. That's making it very different working with somebody like you versus, I mean, I just love, I'm the same way about vaccines or anything. It's not like I'm no vaccines. It's just be informed of what the sheets say inside the drugs you're taking or inside the surgery. Like, know all of that. And it is a lot for anybody to digest, which is why having advocates can help, whether they're family members or friends, some kind of witness, because you're so caught up in your own experience to have a confidant that can objectively help you and take information for you to digest later, because it's a lot to take in. But your take on it is really refreshing, and I'm sure because of that is why you're doing so well. Do you want to tell everybody about your new space that you're opening in Texas?
Yeah, by the end of this year, we'll have a surgery center that will be, geared really for what most important, which is helping with the experience. I feel like obviously surgery is a big endeavor, and although we've done thousands of cases and have many, many years of experience, it's still for each person, it's very, it provokes a certain, feeling. And they relate a lot of, it's very easy to focus on negative things. So in our, environment, we want to make sure that we're providing as much preparation because I feel like that's the way to avoid these experiences that are, you know, ones that they're worried about having. We work very hard on the front end to get everybody's supplementation and testing and diet sorted out, their air quality and their fluid quality and their food quality, all the things that I feel are akin to providing, better outcomes. Although the research is not there, I think if you just use a little common sense, you can understand why.
Well, aren't we all our own research project, is what I would like to say. Your all scientific experiment, and your outcome is based upon your compliance, and you're going to get exactly what you put into it tenfold. So your science experiment is you're the variable. So figure that out.
Yeah. I I want to be able to, before I'm in the dust and in the really add to, both, the book behind me, or I'm sorry, the book over here, highlights our programming and we know it works. So, can we do a randomized controlled trial to show that my patients would do better than another doctor's patients? That seems a little unfair in terms of patients. That's something that if you show differences, they would stop the trial because they would consider it to be like a not appropriate way to treat patients. So I think if we're all just, mindful of getting ourselves into, you know, a proper place, mentally and physically prior to any undertaking, anything we do, then our outcomes are outcomes. And we all believe that those would be better in that setting. So that's the way we look at it. And we look forward to opening that and serving, more and more clients from all over the world in 2025.
Yeah, and that's what's so beautiful. And I give you so much credit, Dr. Whitfield, for figuring out how to take surgery to the virtual planet, because that is not an easy task. And I know how many lives you're going to impact and all the shows that you've been on and the book you're writing. Please follow him. We all know somebody that this affects them, and having a fresh look at it with somebody that's willing to have the tough conversations and willing to look at it, inform you, and help you make the right decision for you at the right time is just such a gift. And we thank you for your time. And I look forward to talking to you more about scars, because I think there's a lot you can help with folks as you're treating them with scars that I can't do that you could do, that would also impact the world. So I really appreciate your time today. And thank you all for joining us, and stay in your heart. And is there any last influencers or anybody out there that you think is really cutting edge, that's really doing it and carving a new way like you are in BII, that you think should be on our watch lists? Because I know one thing about you is you know what's happening in the world. You have your thumb on the pulse, my friend.
Yeah, I think, yeah, I mean, that's a good shout. And there's a doctor who published several papers. First of all, if you want to learn more about what we do, just go to the website, drrobertwhitfield.com. That has avenues to all of our, um, if you want to say, content. And
Your
Dr.
podcast too. What's your podcast?
Yeah.
We'll put all that in the show notes for you.
Yeah, I'm going to give you, I don't want to say the name wrong.
Okay.
You say it's Dr. Ashoff. That would be someone who would be great. Azahoff. Dr. Azahoff.
Okay.
They've published on this recently. And I think, more and more you're going to get, there's been 194 papers published since the breast implant hearings in 2019. So that's quite an uptick versus the, years before that. There's a scientist named Mithun Sina, who's published on a molecule called oxylipin tenhome. And that molecule is produced by the interaction between the fatty tissue and the bacterial biofilm. Causes an oxidative reaction between the oleic acid in the breast tissue, and then it creates this oxylipin. So that's a now cause and effect relationship that downstream affects macrophage polarization and ultimately leads to immune system activation. So those are all, not pie in the sky things anymore. They're all published, and there'll always be folks who choose to not kind of address it. But I feel like if someone had a red swollen breast in every instance of this, there wouldn't be any confusion about what was wrong. But because that's not the case, because it's a quote unquote subclinical, infection or
there's nothing else left. It must be my breast implants is what ends up happening.
Right. And because I didn't demonstrate it in every single specimen, it's not uniformly a bacterial contaminant. So, I said, and I'll stick by it because it was over, 600 samples that we looked at. So it's not a small number. 29%, had a bacterial contaminant on PCR testing. And so that lends itself to what is the other 71, percent. And of course, it's a combination of our genetics and toxic burden, all these exposures we get, our gut health, our, food, our air quality, fluid quality, all the things I was discussing. That combination, although it seems like I think it's common sense, but others feel like that's a lot and you can't change it. I think you got to start wherever you can and work on those and control those to the best of your ability.
Close the gaps, as I say, close the
Yeah.
gaps in your lifestyle so that you're not having to filter as much out. I mean, I look at the body as a filter, and if you're using the breast, any kind of implant in the body, then that's kind of how you're using some of your filters. So then you got to clean up the rest of your life so you can tolerate it, because there's a balance. It's all about balance. Well, thank you so very much. Do you have any, do you want to give them your book title? So is that on Amazon? Is that where they buy the book? I
Yeah.
presume.
Called Sharp. That's what's above me.
Yeah.
Sharp is available on all of the platforms, and it's a really easy, smooth read into what is a can be complex sounding program, but we make it pretty simple.
And your program, your virtual program, is a group program, a one-on-one program? I presume it's group.
Yeah, so we're running groups now. Before, you would have to be a patient of mine specifically to run it. Now we've opened it up to groups so that others who've explanted elsewhere or are not going to explant can participate.
That's great. That's wonderful.
Yeah.
That's a true service. I can only imagine how held those women feel and have actionable steps to take to clean up after that. It's beautiful, because the surgery is just the first part of it, right? Getting it out of the tissues is the other part.
Yeah, we want to make sure that we provide as many opportunities for healing as possible.
Yeah, it's beautiful. Well, thank you for your mark on the world and your continued expansion in this world of this very touchy subject that needs a lot more uncovering and a lot more honest conversations about it. So I'm sure this is not our last, Dr. Whitfield. Thank you so much for your time today.
Thanks for having me on. I really appreciate it.
Absolutely. And thank you all for joining us. Well, champions of the vibe flow community, energy flowing through that body, thank you for sharing this time with us and getting through the entire episode today. I know time is what we're spending here as our currency on this planet as people, and it really does mean a lot that as we devote our time and energy into creating this content, that you stuck with us throughout it. So if you would like more on this particular subject from this expert and get that free gift, make sure to register for our Energy Flow Forum. And you too, with a very nominal price, can access all sorts of upgraded content and deeper dives into the very subjects that you love: energy, fascia, lymphatics, oxygen, and water. As you know, as always, on this show and any content that we create, it is for your own health purposes. This is not intended to be advice or medical diagnoses or professional advice. It's purely information that if it resonates with you and you apply it and you upgrade, we love to hear about it. What a great coincidence, and we're happy to be on that journey with you. If this doesn't resonate with you and you know somebody it will, pass it along. And in the meantime, know that we truly are here to show you and explain to you and be with you through this lovely journey of life, and to share our experiences together and help each other upgrade, because that's how we're going to do this, together, collaborating with love at the center. I'm Kelly Kennedy, and I am so grateful from my heart to yours to share this time, energy, and space with you.